Hello, everyone, and welcome to the fourth webinar at the 19th Social Entrepreneurship for Innovation in Health course. We'll take a brief pause so that everybody can join the session. And if you're able to see us while your peers are not yet able to see us, please advise them to refresh their browsers. You can drop a chat note in the discussion forum that you find below the screen. Also, please don't forget to take the survey that you find below the screen that asks you, are you watching live? Please click yes to get your extra credit points. Please note that this survey is not going to appear if you're watching a recorded session. Okay, let's get started. Welcome to our weekly webinar once again, and the theme of our conversation for today is co-creation and leveraging shared value. This is also the theme for this week's module. Before we dive into our conversation with the guest expert for today, here's an important reminder. As you're aware from the course overview, Module 4 and 5 are about co-creation, where you will learn about real-world and potential co-creation proposals spearheaded by health innovators. Both this week and next week, you have assignment submissions that we recommend you to prioritize so that you can get feedback from the facilitators. And now, a big and warm welcome to Cynthia Mckinney Drayton to the session. Please don't forget to drop your questions for her in the discussion forum that you find below the screen. And we'll take as many as we can during the span of the session. Cynthia is the Director of Corporate and Foundation Relations at Project ECHO, which was founded to bring quality and cost-effective healthcare to rural and underserved communities by building capacities of local clinicians around the world. Before joining Project ECHO, Cynthia spent over a decade in Ashoka, supporting Ashoka fellows who are social entrepreneurs with system-changing solutions to some of the world's most pressing problems. She met Dr. Sanjeev Arora, the founder of Project ECHO and an Ashoka fellow, through an Ashoka Connect. She saw a huge potential to make a difference, so she joined Project ECHO to help them scale the solution. Cynthia also played a vital role in building Ashoka's practice of strategic partnerships with corporations and foundations such as eBay, Intel, and the Robert Wood Johnson Foundation. These partnerships addressed various social sector challenges such as health, well-being, education, and youth development. Cynthia is a graduate in political science and French and holds a master's degree in communication from New York University. Welcome to the session, Cynthia, and thank you very much for joining us today. It's an honor and pleasure for us to host you. How are you doing today?
I'm well, and thank you for having me. I'm really excited for the conversation today.
Thank you, Cynthia. Cynthia, I already introduced you in quite a great details, but still it will be interesting for us to begin this conversation by knowing from you about your professional journey. So can you tell us briefly about your professional journey?
Sure. As you mentioned, I was an entrepreneur. I started my own business when I was 23 years old. And that business, I won't go into the details, but it grew into a national, certainly U.S. distribution. I was manufacturing clothing, actually, in the Philippines. That started, I have an academic background, but I started the business because I was working in New York City. My first job was with National Geographic magazine, and I made very little money, and it was very hard to live in New York City. So that was really the impetus behind starting the business, but the journey through the business is really what brought me to today. And when I was manufacturing in the Philippines, I had the privilege of working with women in cottage industry in small villages around the Philippines. And there's this one village, they do incredible handwork, and it's pretty much a matriarchy in the Philippines. Women, and it was really the entire town, the entire village, no running water, no electricity, but these women were really hardworking, had beautiful skills, artisan type skills that were passed down from mother to child, and so on and so forth throughout the generations. And this particular village I'd gone out and thanked because I had the entire village making one item, a mass-produced but hand-finished item. And it was such an important part of my success. It happened to be the #1 selling item in the Neiman Marcus catalog. It kind of exploded. It put me on the map. And the next year I grew about 500% from the previous year But those women then asked me back the next year. And so I went back out to the village and they said, we really are excited to show you something. I arrive, and previously there had been no one running water, no electricity. But as it turned out, these women in this village had pooled 20% of their income to create the first school that the kids in the village had ever had the opportunity to attend. It was through technology. The Philippines has over 11,000 islands, and so they were early adopters of technology. So they brought in a big screen TV, this very rural part of the Philippines. And these kids, when I arrived, they made sure that I arrived just as they were sitting down to a math lesson that was being broadcast. And they came up to me and shared this news with me. And it was really my aha moment. I had not started the business to make a difference. Really, I had started it to make money. But what resulted through this collaboration with these women was really the first school that these kids had the opportunity to attend. And that went on. That really, when I think back on that moment, I continued to run the business for many years. I took time out, but I always came back to that moment. And when I was looking at a second career and looking at what I was skilled at doing, this organization called Ashoka kept coming up. And so really it was through that, I was like, this is the organization I want to work with. And so I actually ended up joining Ashoka, as you know, and stayed there about 10 years, as you mentioned when you introduced me. And that led me, of course, to meeting Dr. Sanjeev Arora.
It all seems that this was in progression. Like you had an entrepreneurship experience, you saw the social impact of that entrepreneurship, then you joined Ashoka, and then you joined an Ashoka Fellow. So it was a beautiful transition, I would say, all through your professional life.
Totally. And that's actually, when I joined Ashoka, I also have a sports background. So I'm a national figure skating for U.S. figure skating. And actually, the one partnership you didn't mention was the very first partnership I came on to lead was with Nike, the shoe manufacturer. Because of my background in kind of the garment industry, understanding that, but also my sports background. And so I came on, that was the very first partnership, collaboration that Ashoka had with a corporation. And so I learned so much from that opportunity and from leading that partnership. Neither one of us had partnered with the other sector. And so it was fascinating to see. I mean, we had internal goals and external goals, but we were really, Nike was not set up at the time to be a partner. They basically thought of us as a client. They were paying us to do a particular job, and it was my job to teach them that that's not what partnership is about. That's not what collaboration is about, and that it is about shared value. And so that was a journey, and to take them along, in a sense, a change-making journey. And so, the things that I learned during that time at Ashoka, especially those early years, I use every day in what I do today.
Great. Actually, I have a set of questions about everything that you're talking about: collaboration, co-creation, how you actually spoke to the stakeholders, especially the corporations, and telling them that we are not agencies for social marketing. Rather, we are co-creators with you, co-creators of social impact. But before that, I'll take a step back and I will request you to share with us the beautiful story of Project Echo and your role in building strategic partnerships there. And then I'll bring all the questions that I have around partnerships and shared value and collaboration. And I know you have a presentation, so feel free to share the screen when you are ready.
Okay, I'm going to start before sharing the screen with just a quick story, which was the impetus behind the development of Project Echo and the Echo model. And so back in 2003, Dr. Sanjeev Arora was a gastroenterologist. In fact, he was the only gastroenterologist that was treating hepatitis C in the entire state of New Mexico. New Mexico is a poor and rural state. We have a very large, we're a majority minority state, meaning that there's no one population that is dominant. We have a very large rural, but also Native American population. And we have 26 pueblos, what other states call Indian or reservations, Native American reservations, we call Indian pueblos here in New Mexico. And so, many of those are incredibly impoverished and, of course, rural. And so in the state, there's just the scenario, there were 28,000 cases. And we know this because it's an infectious disease, hepatitis C. And so it's a reportable disease, what we call a reportable disease. As the only person treating it, Dr. Sanjeev Arora could only treat about 150 patients a year. And this is a disease, even 20 years ago, that we knew how to treat and cure. And yet, if you don't treat it, if it's left untreated, it turns into liver cancer and death. And so Sanjeev was really kind of thinking about, what is he going to do? There was an 8-month wait to see him. And one day a woman walks into his office, and she was in tow with a 14-year-old boy and a 9-year-old girl. And she walks into his office and says, I have hepatitis C and I'm here for treatment. And he says, oh, how long have you had it? And she said, I was diagnosed 8 years ago. And he said, well, why did you not come in earlier for treatment? And she said, well, I'm a single mother. It's very difficult for me to take off work. It's a 3-hour drive. And when I called your nurse, she said there was an 8-month wait to see you. And then if I got treatment, it would be a 12-month. Every month I would have to drive back and forth for this chemo-like regimen for treatment. And so she said, I just couldn't do it. I didn't have the resources, and I'm too far away, and I have to work and couldn't take off. And so he did an ultrasound because he had asked her, why today? What made you come in today? And she said, well, because I have a pain in my upper abdomen. And so he did an ultrasound, and sure enough, she had cancer, liver cancer, which is what it turns into when untreated. And she died about 6 months later. And so Sanjeev asked himself, what could I have done? We know how to treat. We have all the medicines. We know how to treat this disease. What do I need to do so that people get treatment and people don't have to die of a disease we know how to treat and cure? So he started Project ECHO. I am going to share my screen now. Let me know if you can see that. And I'm going to put
it's coming up.
There we go.
Yep.
So the scenario that I just talked about plays out over and over again all over the world, pretty much every day. So for example, you can see in this slide, and I'm going to go quickly through this just to give you an idea. But I know that you have these slides, they're posted on the site so that you're welcome to go and look at this in more detail. But for example, every day, 15,000 children die before their 5th birthday. All of these things are things that we know how to treat and cure. So at ECHO, our mission is to democratize the implementation, and that implementation word is super important because it's what differentiates the ECHO model from other training models. Implementation of best practices for healthcare and education for underserved people all over the world. And so it's what we call moving knowledge or democratizing knowledge, but not moving people. And so there are really 4 pillars of the ECHO model. It's a simple model. We use simple digital technology, Zoom, just like what we're using today, to leverage scarce resources, and that would be the knowledge. And so it's one-to-many video conferencing so that people don't have to travel. They can join ECHO from wherever they're at, and it tears down those barriers. we share best practices, so that expertise, which isn't getting to the right place at the right time. And then even though Dr. Sanjeev Arora was willing to share his expertise and democratize his knowledge to get that knowledge to where it needed, when he first started, these clinicians all around the state, these rural primary care clinicians, were basically saying, no, we can't do that. That's such a liability. You have to be a specialist. You're a specialist. You can treat it, but we can't do that. And yet we know we need to build capacity for specialty care, because in some places, for example, in Laos, there's one oncologist in the entire country. And so people don't have access. And so he thought to himself, how did I become a gastroenterologist? And he said, oh, well, I was doing my fellowship in Boston, and I would see a patient, report back to my professor, to see another patient, share with my peers and my professor. And after 2 years of doing this, day in and day out, they started calling me a gastroenterologist. And so he said, aha, that's exactly what I'm going to do. We're going to use case-based learning in ECHO. And that's what helps people master that complexity, and to build the confidence. And as they are being mentored, what we call high frequency, low dose exposure, keeping in line with adult learning theory, then week after week, after about a year, people start becoming an expert. And then, of course, the last pillar is that we evaluate and monitor all of our outcomes, which is super important to track our impact. And what is also, when you can show that impact, then it also is easy to scale. And so this is just a picture of the very first ECHO. You can see that that's Dr. Sanjeev Arora right there. And these are what is a hub and spoke model. So these are the different primary care clinicians that are joining. And just a reminder that this is not traditional telemedicine, super important, as we all saw during COVID, but still it doesn't build capacity. You can only see one patient at a time. So ECHO is really a capacity building model. And so one of the things that Sanjeev knew is that he had to do an evaluation, a patient level evaluation, to really show that this would work for any complex disease, not just hepatitis C. So basically, and you can look at this later, but basically the outcome of a study, the very first patient level study that was published in the New England Journal of Medicine, leading medical journal in the world, was that if primary care clinicians participated in ECHO, then they could have the same, if you look at the previous slide, slightly better for the people that participated in ECHO than even these specialists. And so they could have the same cure rate for a disease like hepatitis C. And so that led to, just when that was published, people from all over the world were like, I need it for diabetes. I need it for neurology. I need it for nursing, for emergency medical services. And so today, fast forward 20 years, and we now have ECHOs all over the world that are addressing all kinds of disease areas and process improvement as well. And today we have 500, it's over 600, it's a slightly old slide, peer-reviewed publications that show ECHO works. And really what we're trying to solve for is this increase in knowledge. We know we don't have enough specialists to go around, but on top of that, the bigger issue is actually that medical knowledge is increasing exponentially. And there's no way to keep up with it without an agile, simple model like the ECHO model. And so one of the more recent huge collaborations we had was with the US government during COVID. So as you can imagine, during COVID, we had this global network, and we just knew, even before funding started coming in, that we had to pivot and meet the moment. And so our partners, we partnered very extensively with the government, and the US government came to us. You might remember less than 2% of the population in the United States live in nursing homes, and yet 40% of COVID deaths were occurring in nursing homes. And so they came to us, actually gave us the largest grant we've ever gotten, $237 million, with the idea of training every single nursing home and all staff in nursing homes, because the need was just so great. And so we did end up training over 9,000 nursing homes. And, this was considered a great success. We continue to collaborate with this branch of the government even today. And we still talk about this as being an incredible success. This is just a quick slide of our network around the United States. And then cancer as an example of just one disease area where we have different cancer hubs all around the world. And then we also bring them together so that they can learn and share best practices with each other. So we have a cancer collaborative, and we do this with a lot of our disease areas. As we grow and we have a global network just in a particular disease area, then we start to bring everyone together so that they can learn from each other and also support each other, because it's really the community of practice that is so powerful with ECHO. And our very first, when we went into Africa, this is very typical. This is a great example of collaboration and co-creation. The ministry, we work very closely with governments all over the world. It's super important in healthcare, as you know, so it's actually our sustainability model. We want to engage the public sector, the ministries of health, in everything we do. We know that that's our exit strategy, in a sense, that they will eventually, when we can show them through our evaluation, through the model, that they can achieve their mission. It's not our mission, it's their mission, with speed, scale, lower cost, and greater efficacy. We know that they'll adopt the ECHO model. We never charge. We use philanthropic dollars and our partnerships, our funding partnerships, to drive our work. And then we are looking to get adoption so that we can move on. And we know that that'll sustain and will continue to grow the movement, snowball the movement as we move forward, because there are 6 billion people in the world that don't have access to best practice care. And just an example, in Africa, it looks a little different, where we have bandwidth issues at times. We have Zoom rooms around, I think this might be Tanzania, where people come together. They still don't have to travel far, but they have to be, if internet access is an issue, then there are some workarounds that we have. I won't go into this, but these are just some other collaborations. And recently the Kenyan government came out with this study that's showing that it costs them, before ECHO, it costs them over $800 to train one clinician. And then with ECHO, it was reduced to just slightly over $20. And what they found, though, was that the ECHO model of training, because it's just 100, it turns traditional training upside down. It's not just 3 days, you go in and then 6 months later, you never use what you learned because you haven't been mentored over time. With ECHO, it's what we call the drip irrigation model, where it's that high frequency, low dose, over and over again, being mentored so that you implement. Coming back to what I said in the mission, that was so important. You actually implement and not just learn it in your head and then forget it 6 months later because you're not actually using it. You don't have the confidence to use it. And then, of course, I said collaboration with ministries of health is critical to long-term financial sustainability and social sustainability of our work. So these are just some of the ministries of health, and then this is our global network. And then in India, we actually have a MOU with the federal government. We partner with them on all of their national health programs. With the WHO is another example of a collaboration, and actually with what they call their Collaborating Center for Digital Learning and Health Emergencies. This really came out of our collaboration during which started during COVID. And you can look at that more closely on your own. And then, of course, I would say for this particular, of course, 3 is important to us. 4, gender equality, we actually apply gender lens in all of our work. There are any number of ones that we feel we work toward, but the most important one is actually Partnership for the Goals, number 17, which is all about collaboration and the idea that you can't possibly achieve these SDGs unless you have massive collaboration. So I'll stop sharing there. And
thank you, Cynthia. I think it was not just the story of ECHO, but basically you had touched a lot of factors which built, which is part of our module. And I have questions around that. So you've already lightly touched on everything, how the capacity building that you are doing of the local clinicians and how you're promoting the peer-to-peer learning. The course platform is also doing the same thing, is bringing together the healthcare professionals and also allowing the same kind of activities that Project ECHO is also indulging in. So I would say that this was a great, great context. And with that said, I am going to turn to you with some specific questions around co-creation and leveraging shared value. In this module, this week, participants will discuss the importance of collaboration amongst institutions and sector. So can you tell us more about this context in context of healthcare? Can you tell us the significance of collaboration in healthcare across different institutions and sector?
Yes. So in healthcare, you cannot divorce collaboration from improving and strengthening health systems, as Ashoka is certainly given credit for the whole idea of systems change. And that, of course, Dr. Sanjeev Arora would not be an Ashoka Fellow unless his focus was on that systemic change. That takes a long time, and it requires, you can't even look at systems change without bringing a multitude of stakeholders together, because that's what systems are. You can't work in silos. It's the very nature of systems change that requires that collaboration, and finding that shared value is what drives it, because collaboration is actually very difficult, but it's a lot easier where there's shared value. And so really understanding what that shared value is, I think, is important. And when everybody has something in a sense to gain, it's a win-win sometimes, because there's a multitude of stakeholders that are coming to the table, all working toward the same goal. Dr. Arora sometimes shows a picture of a movie and with Francis Ford Coppola and Marlon Brando over his shoulder saying, how do you do what you do? How do you make a great movie? And he says, you have to make sure everyone's making the same movie. And it's really his way of explaining the necessity. You can't even talk about making systemic change in healthcare without collaboration.
Absolutely. I love that example. In terms of collaboration, I wanted to ask first about the significance of collaboration, and then kind of, take a few things, few aspects of collaboration, like deep diving into shared value. But we have a question from the audience, so I'll take that first. So the question is, how do you navigate challenges and conflict that arise during co-creation initiatives? And this is being asked by Margaret Ovino and some others. I also had a question around challenge. So I'm going to I'll give you both the questions so that you can answer accordingly. I had a question where I wanted to ask you, what are some of the common challenges and obstacles organizations face when they are implementing co-creation strategies or leveraging shared value? And how do you overcome that? To that, I think what Margaret has done, she's also added conflict. So we'd like to know, one is a natural challenge or obstacle, and then you also add conflict to it.
Yeah. So I think there are just some basic principles when it comes to any conflict in life and in your professional work. The first is to not procrastinate, to deal with it, but deal with it honestly, with respect, and with ethical behavior, just all the things that I hope everyone thinks about, that's just, they're part of who you are. And so bringing that authenticity to the table. And I think whenever you have to you have to deal with conflict head on. But when you find common ground, in a sense, this is also shared value, you can bring people to the table because you do have that shared value. And it's a lot easier when you bring it back to what brought you together to begin with. Then you can always work out whatever the challenges are. I'll give an example. Obviously, Boehringer Ingelheim is a pharmaceutical company. My role at ECHO is to bring in funding. Because of the importance of collaboration, we can't afford, if we're really going to move the needle and create the access to healthcare that's needed all over the world, then we have to find a way to work with everyone at the table. And that includes pharma. Pharma has, sometimes not the best reputation. There's the possibility always of conflict of interest. I'm very careful with, many of these companies have literally 90,000 employees around the world. And so not everyone, just like in the general population, is going to share the same values and be ready for the kind of collaboration that leads to positive social change. And so with pharma, I often liken what I do to raising my own kids, setting the expectations high and having them rise to it, and putting out there right away to avoid. I like to preempt conflict and try to avoid it by just tackling it, in a sense, head on. So I always have a conversation about conflict of interest. And we have some laws here in the United States that really support that. For example, we give a lot of accreditation, CME credits, for attending ECHO. And we've worked for policy change over the years to make sure that we can do that, to make it an incentive for people to join ECHOs and become the experts that we know that they can be. And so when a pharma company comes to us, there are certain rules for us to accredit. There can be no conflict of interest, which means the pharma company can really only be a funding partner. They can't have say in the curriculum because it wouldn't be independent then. We can never be seen as a marketing arm of pharma. So there's inherent conflict, in a sense, in working with pharma, yet we manage to do it and do it quite successfully. And we both feel that we're profiting from it. For the pharma company, they have to accept that it's going to be more indirect, and many, I particularly work with medical affairs, because it's not a marketing arm of pharma. They don't have the same direct bottom line, for every dollar they spend. So I'm very careful as to who we partner with, but it's absolutely necessary for everyone and benefits everyone to find that shared value and work toward collaboration.
Great. So alignment on shared value, and also setting the right expectations, and also making sure that you preempt some conflict of interest and talk about it in
Absolutely.
advance. And
can't be the elephant in the room. It has to be talked about.
Yes. And if despite that you've land up in a conflict, then also talk about it. I think conversations can arrive into solutions. So it's good for us to continue the conversations. Thank you for
Yes.
that insight, Cynthia. Thanks. I'm going to move to another factor that we are touching in this week's course module, and that is shared value. You've already mentioned that so many times when you were explaining some of the other aspects. Um, we want to talk about the concept of shared value, where we talk about connections between societal and financial growth and the importance of company integrating business and social contribution. Can you explain what shared value means in this context and how do companies help in making healthcare systems better?
Uh, as my title suggests, corporate and foundation relations, I'm working with corporations, whether they're pharma or other corporations and foundations all over the world to create a better world for people. I think everyone can galvanize around that concept. And when you find in a sense, it's that mission, that passion for which everyone is aligned, it becomes so much easier to collaborate. And, you really overcome the biggest barrier in a sense. When there's no alignment, where there's no shared value, there's really no ability, no incentive, I would say. That's what really creates the incentive. And so corporations, there's I'm sure everyone's heard the term ESG, environmental, social, and governance. And so most corporations, when I first started working with Nike, none of this existed. Nike, in fact, was one of the first corporations leading the pack in a sense. And I'd like to believe that with through our partnership at Ashoka, to realize that they had their CSR, their corporate social responsibility, was an appendage to the core business. And after working with Ashoka for a number of years, they actually did a total reorganization of their business. Since then, many, many corporations have followed suit. But when they reorganized, they integrated from corporate social responsibility being an appendage on the side, not integrated into the core business. They recreated so that they actually had, for example, they had an innovation lab, which is that's the part of the core business that, in a sense, corporate social responsibility was sitting in. But what their reorganization did is to really create that framework for environmental, social, and governance. What you've probably seen, there's a global reporting initiative, GRI. A lot of companies now report. Companies used to create an annual report. That was just a financial annual report for shareholders. But today, the world has really changed, and corporations have realized, even if they've been brought kind of kicking and screaming, they now understand that this newer generation cares about their work. They don't want to just work for a company for a salary. They are passionate about their work, and they don't want to work for a company that doesn't recognize and is trying to be a good community steward and is trying to make the world a better place, not just one where they're benefiting financially. And so companies have started to realize that to attract talent, to be prosperous financially even, that it's going to require not just investing in the social and the environmental aspects of their business, but really to be authentic about that work. Because that's another thing that we see in the research is that when there's no authenticity, so in the very beginning with Nike, there was no authenticity. They had a problem with child labor, and they wanted to use us, in a sense, Ashoka, to kind of whitewash their image. And our goal was to change them, to turn them into change makers. And so the world has changed for the better in that way. Of course, we've still got a long ways to go, but there's no question that corporations are seeing the value of shared value, and then that makes it possible to collaborate with them.
No wonder I introduced you as saying that you created the building blocks of practice of strategic partnerships in Ashoka, about kind of working with foundations and with different partners. And I was about to ask you about an example of co-creation, which you have already mentioned several times about Nike, like how they came and how they changed themselves, and now they are in the sphere of change making. So thank you for automatically answering my next question, which was about the process of co-creation, an example of co-creation and what made them successful. And I also would like to kind of summarize what you were saying is it's important for organizations or at least businesses to see themselves as relevant to what they are doing for communities and also align themselves authentically towards the contribution that they are trying to make. So very important point. Thank you so much for that insight, Cynthia. Also, I have another question for you, which is a follow-up question to kind of how we nurture shared value is how can business ensure that co-creation initiatives are inclusive and equitable, benefiting all parties? And I'm really asking it from the business's standpoint and not like stakeholders like ECHO. It's from the business's standpoint.
Yeah, this is somewhat of a difficult conversation in the present environment that we have. As we know, there was this rise in DE&I all over, raising it to the C-suite, chief diversity officer, very important, and I still believe super, super important. We are in a period right now of rolling a lot of that back with super, for any number of reasons, which, we don't need to go into. But I do think that it's really important for corporations and organizations. I know we're not talking about organizations like ECHO because everyone assumes that we, practice that to start. The fact is, even ECHO, like we received a org strengthening grant to look at our own, house in a sense and get it in order. For example, women, we're going through this process. We're not perfect. We're going through the process ourselves. In India, we are looking to put more women. We have a, organization called ECHO India, which is part of ECHO, but it's a separate entity for a number of reasons. And we have been going through the process of actually creating, trying to be more diverse, inclusive, more women leaders in our leadership team. We certainly have that in New Mexico. And I think corporations are also trying to do that, or at least were. As with anything, the pendulum swings, we go back and forth, and I hope that trend picks back up again. Equity has to be at the center of, at least for us, if there isn't that value, that there's no alignment, because we won't even work with people for example, we won't work with people that are for profit. They can be a funding partner, but if they're for profit, then we're not going to give away the model for free, because we're really trying to make the world a better place for the rural and the underserved. So I don't know if I totally answered your question.
Yes, I think it was a bold answer, but yeah, I mean, that's how you're trying to subtly nuance the power dynamics. Completely understand that, but yeah, given today's scenario, I think it was an apt response. So, Cynthia, I'm going to move to a question from the audience, and the question comes from Dunja Vujo Sevik, and Dunja is asking, do you think the landscape of social entrepreneurship and intrapreneurship have changed in the recent years and improved? And what is your advice for the new social entrepreneurs and new social intrapreneurs stepping in the field?
So I absolutely think that the ecosystem for social entrepreneurship and intrapreneurship has changed dramatically and for the better. I think that There are a lot more networks. I think it's really important. It's often said that being a social entrepreneur or an entrepreneur can be very lonely. It's actually why I find that shared value and finding people to collaborate with is so important, because it makes it less lonely. It's actually what ECHO does. We build those community of practices to support clinicians when they're in rural environments, so that they have a network, a community of practice, as we like to call it, so that they're not feeling lonely. And it also helps with retention. That's another benefit that we've seen. And so the landscape has definitely changed. When I first started working in Ashoka, no one had heard of what a social entrepreneur, let alone a social entrepreneur, was. And so I think that it's more common today. We've built awareness. Like any movement, it takes time for that to happen. And we've seen that happen. And then with the corporate sector, and we have seen this embracing of the idea that 2 + 2 does not equal 4 when you bring people from the social sector to partner with the corporate sector. We see that exponential impact when there's collaboration like that. So 2 + 2, you have several stakeholders. 2 + 2 + 2 + 2 = 50. And, that's what collaboration is capable of achieving. And so, yes, it's absolutely changed, and for the better, but still a lot more work to be done.
Great. So,
and
go ahead.
Well, that last part of the question, I think, was advice for social entrepreneurs.
New social entrepreneurs.
Yeah. Well, so I would say for new social entrepreneurs and entrepreneurs, when you need to, and I think this is advice for anybody's career, by the way. I personally could not do my work unless I had a fiery passion for it. I care about the impact. I care about, that's what drives me even more than the monetary aspect of any job. And so, and I've actually left positions and where I made more because I just didn't have any, I didn't feel the passion for my work. And so I think if you're looking, it should come from you authentically and be something that you're super passionate about. And that will change every aspect of what you do. It will not seem arduous or laborious. It will be a joy. You will see the glass as half full. People ask me, how can you work in a field where there's just so many problems and they seem so intractable? And I'm like, because I see the solutions. And so I think that when you focus on a solution, and you understand that solution because it's part of who you are, in a sense. It's arisen out of, like, for example, for Sanjeev Arora, it was out of a problem that he experienced firsthand. It's finding your own aha moment. For me, it was that school in the Philippines. So finding what drives you and understanding why you're passionate about it. I think, in a sense, knowing yourself allows you to be more generous with who you are, with your strengths, and to drive social change.
Great. So I think two things I'd like to call out for everybody. One is that when you look at the landscape, 20 years back, social entrepreneurs were more working in silos, and now they have organized themselves into communities of practice where they are able to learn from each other. So that's one big change that has happened. And I also loved your advice about the aha moment. I think that has come from a lot of the guest speakers also, where they say that pursue, a passion, or pursue a mission where you see a connect, and you can do it for a long time. So thank you, Cynthia, for reiterating that. We're fast moving towards the end of this session. So I have three more critical questions. So I'm going to bring them quickly to you. One is, what do you see as the future trends or opportunities in co-creation and leveraging shared value for business and society, especially for healthcare?
I think it's critical that we continue on this path and we find ways to collaborate more and more. We recently, as an example, we recently, actually, we're 2 years into it now, but we started a partnership that is funded by pharma, the largest pharma company in the world. There's a huge interest in Africa in emergency preparedness and response, antimicrobial resistance, really a lot of the work that we're already doing with the WHO. And so we were given funding for antimicrobial resistance and building communities of practice all over Africa for that. And in doing so, and this is a pharma company that's giving away their drugs for antimicrobial resistance at cost to governments. And so we're working with ministries of health. So ministries of health, the WHO, pharma company, NGOs, academic centers, all collaborating together. But what we found is, as we went into each of these countries, because it's such an important aspect to prevent the next pandemic, that there's a lot of people. We're not the only players in the field. And so what ECHO came in to do unexpectedly is we realized, oh my goodness, there's 10 different programs in Ghana working in antimicrobial stewardship, and they're all working in silos, as you just alluded to. And so ECHO's come in to be the convener. And we have welcomed that role. It's, a role that we like to play. But now everyone, instead of working in silos, is working together toward greater impact. And so the shared values are there. And so, I think of that and think, that's an example of where we need to go in this work in healthcare, where you really, because as much as we talk about collaboration, I'm telling you, it's still difficult. ECHO has been able to do it because we've gotten out of our own way. It's a mindset shift. It's one of moving from scarcity to abundance, of sharing your expertise instead of guarding it, of collaborating instead of competing. And so I think that's the mindset shift that needs to happen.
Great. I was actually about to ask you about the type of partnerships you will prioritize for future, but you already answered that you're probably going to look at these silos where innovation is happening to bring together solutions in the healthcare and then kind of plug it all into ECHO so that ECHO can become that device which is magnifying all solutions. Thank you, Cynthia. In interest of time, I will have to move to my finale question for you. And thank you very much. I think all the insights and experiences and the advice that you have shared so far from your experience of partnerships and co-creation is very relevant for everybody. So my last question to you is, what inspires you to do what you do as a continued commitment? And what is your parting advice to the learners, especially from the co-creation and partnership standpoint?
What inspires me to do what I do, I think I've alluded to, and that is I can't divorce, in a sense. My personal life is my professional life. I'm passionate about making the world a better place, at least as much as any one person can do. I recognize I'm only one person, and I'm well aware of my smallness in the universe, but together, 1 + 1, as I've said, +1 can equal 100 plus. The impact that can be had when you work together toward greater good can be phenomenal and can really change the world. And so I think what inspires me is, that the world, there is so much more that can be done, and that we all have a role to play. And in terms of parting advice, again, I would reiterate that finding your passion, having it be authentic. It changes how you approach life, just how you feel about yourself, how you, the impact that you're capable of having. When I hear people talk about, oh yeah, that's my work life, this is my professional life, I think, oh, that's so sad. They spend all those hours at work to not be passionate, to have to divide it. Like, I only have fun when I'm not at work. For me, it's just as great when I'm at work as when I'm not at work. And, and part of that is because I feel like I'm lucky that I have found a passion and something that I really enjoy doing.
Thank you, Cynthia. Thank you very much for being with us today, Cynthia, and wish you the very best for your continued success. You are a master of creating partnerships and your co-creation efforts. There are questions that we still wanted to see, like, what happens when partnerships don't work, things like that. But yeah, maybe we will continue asking questions on LinkedIn. I mean, I would say that our learners can find you on LinkedIn and can keep sending you some questions to ask you there. But for now, I would just say thank you so much for being with us today.
My pleasure.
Thank you, Cynthia. And thank you, all of you, for watching us live and participating in the discussion forum. Before we sign off, just a very important reminder. Next week, we will meet all of you on Wednesday, 8th of May at 12 noon ET for office hours, which is a live and interactive session with all of you. Yes, you heard me right. It's a special session where Natalie and I invite all of you and all course participants to join us to talk to us about your projects, your insights of the course, and your plans to implement positive change in your institutions and communities. We are very excited to hear your reflections and ways in which you are planning to apply the learnings going forward. So mark your calendars to be with us. And if you have any questions, please do bring them. And just one more reminder about the assignment submission. Please do that as soon as you can. Thank you for being with us, and we'll see you at the office next week.